a small, thin lesion on your arm that can be removed with a simple scraping procedure in the office in 5 minutes may be an adequate treatment for a superficial basal cell carcinoma. For a scarring, thick tumor that's infiltrating someone's nose, trying to scrape that off is not going to be effective. We're going to need to use the Mohs surgery. Why do we want to use the Mohs surgery? Because it gets a much higher cure rate and we can guarantee that it's out. Cure rates for Mohs surgery for what we call primary tumors. These are tumors that have never been treated before. It gives us the highest possible cure rate. That cure rate varies, depending on the study, between 96 and 99% at 5 years, which means there's only a 1 to 4 out of 100 chance that it would come back at 5 years. For instance, some of the other techniques on a face, for instance, might be a lower cure rate. If you try to scrape off a basal cell carcinoma on someone's nose and it's a larger one, the cure rate's only going to be about 85%. And on your nose, you don't want to take a 15 in 100 chance that something may come back. We want to make sure it's out the first time. And the cure rates differ for the other techniques based on different parts of the body. For instance, using this electrodesiccation curettage technique, you can get cure rates of around 95% on an arm. So Mohs surgery or electrodesiccation curettage, depends on how large the lesion is, but the cure rates are going to be about the same. Also depends on what kind of scar we want to have when we're done. In certain places, Mohs surgery is much more important because of those high cure rates. If we look at what are called recurrent tumors, there's a much bigger difference there. Recurrent tumors are tumors that have come back after they've initially been treated with surgical technique or some other technique. The Mohs surgery for recurrent tumors on average is going to give us cure rates that are still around 92%, even on tumors that have shown to be more difficult. Some of those other techniques like standard excisions or this scraping or curettage technique, for recurrent tumors, those cure rates drop down into the 50% and lower range. So that's why it's really important to use Mohs surgery on the tumors that have returned after a previous treatment. The recurrence rates after Mohs surgery are uncommon. Generally, there's only going to be a 2 in 100 chance that cancer would come back after we do Mohs surgery at 5 years. So that's not very many.